The Duffy Health Center in Hyannis received a $2 million 5-year grant to further its mission of providing health care and support services to those who are homeless and at risk of homelessness on Cape Cod. Philip Mangano, Executive Director of the U.S. Interagency Council on Homelessness, spoke at a press event earlier this month.
We know that while the central antidote is a place to live, the most vulnerable and disabled, if you simply place them into housing and think the job is done, we're just setting them up for failure. So if there's another thing that we've learned in the last 20 years is housing for our most vulnerable and disabled neighbors without services sets them up for failure. We saw that in the failure, the abject failure of deinstitutionalization for the past 40 years. But services without housing leaves our neighbors on the streets, in the shelters, in doorways, and on street corners. But when you put housing and services together around our country for that poorest and most disabled person, the person that we would walk by on the streets of Hyannis or in New York City, and we might think, a blanket and a bowl of soup is the best that we'll ever do for that person. Those folk are being engaged. The people who are the most disabled, most complex, with co-occurring disabilities, they're being engaged and placed in housing, and the support service wrapped around them, customized to them, is supporting those tendencies. An 85% retention rate around our country for the most disabled and vulnerable, and the percentage rate that you already have going on here in Housing First is accomplishing a percentage very close to that.